biopsy is a method of the curating the Lekhana Shastrakarma itself. So now we may have the curates for diagnostic purposes, therapeutic, or many times palliative. Diagnostic purposes, the biopsy, which is curating biopsy, or what we call as even times we use the word excision biopsy. It could be therapeutic, as in case of the DNC, dilatation and curettage of the uterine mucosa, in case of endometrial hypertrophy or such conditions. Or it could be palliative, can reduce the size of the lesion at times. So that's about the different choices of the curettage now, and the instruments which we use for the curettage now are maybe different from what Sushila had used. Now we have the different more sophisticated instruments of either electric cautery or maybe the even varieties of instruments. Of course, more of that we have discussed in the Sutrasthana, so I will not go back into that issue. And whenever there is a need of lekhana, Sushila says, samam likhet sulikitam likhet niravasheshah vastmanam tu pramanena samam shastrena nirlikhet kshaumam plodam pichum phenam vyavashukam sasaindho karkashani chaputrani lekhanarte pralapet. For the lekhana, you may use a shastra, a sharp surgical instrument, metallic instrument, or it could be softer substances like either silk or maybe a piece of cloth or a pena, smutra pena, that's some shells of the sea animals, or yavashuka, seeds, these skin of seeds, like the outer surface of the seeds also could be used with the Saindhalavana, or any other karkashapatra, a leaf which has a rough surface also could be used for the lekhana. These are the materials used by Sushruta in those days, whereas now you have plenty of other choices, either sharp surgical instruments of different varieties, or maybe the electric cautery is used for the curating. Then the probing or the yeshana, Nadi Branan, Shalagarbhan, Unmargi, Utsanginashanehi, Karira Balamudibhi, Yeshanyava, Yeshe Bishapa, Netra, Vatna, Budabhyasa, Natyo, Avatraha, Sashonitaha, Chichupa, Audakajish, Lakshnehi, Karire, Yeshe Tutaha. Yeshana is a direct interventional procedure where you use a soft, flexible substance with a soft tip to track the area of either reduced resistance or increased resistance, so that the object of a foreign body which has a different consistency than that of the normal tissue, or a track of the wound which also has a different consistency than that of the normal tissue, can be tracked out or can be traced out. So it's a sort of in this feeling of your sensitive fingers. Your fingers have to be sensitive, and in case of tract-like conditions like sinuses, nadivrana, or when there is a possibility of suspicion of shalya, some foreign body inside, or unmargi and utsangi, the wounds which have more than one connections, and hence you are supposed to track the pus collection from an opening. In such conditions, the yeshana is there. And Sushruta are depending upon the anatomical areas, where there is always a possibility of a tract formation or fistula formation, as in case of the perirectal area or around the eyes or so on. In such conditions also, probing is suggested as one of the choices of diagnosis, as well as it also could be considered as a therapeutic. And the instruments used by Sushruta were either karira, that's the tender bamboo, or bala, harsa, or anguli, etc., which were crude. Whereas with these instruments, or a typical probe, a shalaka yantra, you may do that, but there is a possibility of an injury or missing out the objects. Whereas now you have more sophisticated tools like ultrasonography, which follows the same principle, the principle of the feeling the difference in the resistance of the tissue and maybe capacity of the tissue to echo the ultrasounds, ultrasound waves. So you assess the echogenicity, the capacity to these reflect the ultrasound waves is something like a feeling of the resistance, difference in the resistance. And this method is non-invasive and hence more safer than and more accurate. So that probing of Sushruta is something like the ultrasound. Of course, more about that discussion we had discussed in the Sutrasthana. then samvrta asamvrtaseshu vraneshu matiman bhishak ythoktam aharashalyam prapta uddharana lakshanam, or aharana is the other procedure where you go behind the foreign body and pull it up, hook it up. So extraction by pulling it up is the pulling up the object is the issue. Whenever there is a something irritant object, it could be a blood clot, as such. Exactly the same principle is adopted in case of the Fogarty's technique used in the endarterectomy surgeries, or the clot removal, where a Fogarty's catheter is introduced and a balloon is inflated, and with the balloon is pulled out so that the blood clot in the artery can be pulled out, so on. So such techniques are used for the safety, and that's about the aharana. Then roge व्यसन साध्येतु यथोद्देशं प्रमाणतः शस्त्रं निर्दिध्यात् दोषं च श्रावेत् कीर्तितं यथा व्यधन. We have discussed in the Sharirasthana about the Shiravyatha indications and contraindications. The same hold good. So wherever there is a disease condition where Vedana Shiravyatha can be useful, can produce a change in the clinical outcome, that has to be done, and all the details you have to refer to the Sharirasthana. Then apakopadutaya cha mamsasthaha vilutaha steye yasoktam sivanantesham karyam sandhanam cha. For the sivan or the suturing, the major issue of the suturing of a wound is to achieve a primary healing. In a fresh wound, it's about the primary healing, so that the wound is approximated. Primary healing is depending upon the gap between the two edges of the wounds. If the two edges of the wounds are brought together and there is no dead space, and in the absence of any other factors which can inhibit the healing would occur within a short duration and there will be minimal scar. Whereas if the wound has become infected or the gap is more and the gap cannot be filled up, the gap has to be filled up with the granulation tissue, which gives a bigger scar and it takes more time. The minimum time for the primary intention healing is 7 days, whereas the minimum time of a secondary healing without any complications is 3 weeks. Whereas tertiary is when there are already a complication of pus formation or other issues, and then at the end of that pus formation, after the pus formation is controlled, the infection is controlled, you may have to suture. That's the issue of tertiary intention, which can take any amount of time. And the techniques of wound closure and the materials now used are exactly the similar that of what Sushruta has suggested, but there are some more. We have more advanced capacity materials like the sutures, staples, or tapes, or tissue adhesives. Techniques of different varieties are used. Of course, more of these we have discussed earlier in the Sutrasthana, so that again you may refer to more details about that. And you have certain advantages as such. The materials could be either, it could be the staples, or it could be the tape closure, where you use a tape and with the tape you just make the wound edge close, or it could be the tissue adhesive which could be used there. Then the Tuyagarbhan Anudvaran व्रणान् मर्मगतानपि यथोक्तैः पीडनद्रवैः समन्तात् परिपीडयेत् शिष्यमाणम् उपेक्षेत प्रदेहं पीडनं प्रति न च अभिमुखम् आलिम्पेत् तथा दोषः प्रसिच्यते. Now पीडना is another of the procedure. In the dharana procedure also Sushruta refers to the pidana. The pidana and the dharana, the difference is dharana is done with an intention of producing the opening for the pus formation, where it may not be opened. But pidana is done, or otherwise you apply lepa, where there is already an opening, but that opening is not sufficient to drain out. The draining of the pus is not proper with the existing opening. In such conditions, the pidana is done. And for the pidana, the rule is you apply a lepa without snehadravya and allow it to dry up. See, the other lepa protocol which we have discussed in the lepana vidhi, the lepa is not allowed to dry up, but if it is a pidana lepa, it is allowed to dry up so that there would be a squeezing activity. In the present day situation, you may not have a similar situation of applying any substances to produce a squeezing activity. That kind of a idea is not present in the current these therapies, but pressure bandage is another issue. Pressure bandage is something which is usually done in case of a bleeding ulcer to reduce the bleeding. I don't say that Pidana is a pressure bandage, but the idea of putting a pressure over the wound surface with an idea of reducing the bleeding, or as a method by which the pressure of this flow of the blood is reduced, is tried, whereas the pedal labor, the target is to facilitate the drainage of the pus. So I won't equate that pressure bandage with the pedana, but the only similarity is about the compression, the application of the pressure in case of a wound. That could be the one. And anyway, the idea of a pedana labor is a unique concept of Sushruta, and in many folklore practices, that kind of approach is still practiced and they are quite useful. And the same as I referred to Marmani Mantra is one of that methods. Then तैहिस्तैहि निमित्तैहि बहुधा शोणिते प्रसृतेभ्यं कार्यं यथोक्तं वैद्येन शोणितास्थापनं भवेत्. शोणितास्थापन is hemostasis, to reduce the bleeding, to prevent the bleeding. And to prevent the bleeding, Sushruta has mentioned about 4 protocols. That's Sandhanam, Skandanam Chaiva, Pachanam Dharanam Tatra, Vranam Kashaya Sandhatte, Raktam Skandayate, Chaturvidham Yadetati, Rizarasti Nivaranam. Tata Sampachayet Dasma Dah Sankochayet Siraha. The four procedures which are used by Sushruta: Sandhana, Skandana, Pachana. Sandhana is the application of cold substances, and Skandana is application of substances which induce the clotting, and the Pachana is again Kashaya Dravyas are applied over the surface as such, or Bhasma, Kshara substances which are applied to the surface, or Daha, cautery. In the present day situation, of course, we have different methods of hemostasis. One is to reduce the blood flow. You may use either a tourniquet, or it could be a wax which is applied, or more commonly used is hemostatic forceps and pressure, compression, or hemostatic forceps over the area. Then the vessel could be ligated by suture or the clips as such, or devices like electrocautery or surgery, electrosurgery, which may have blocking effect upon the vessels, or it could be the topical substances like gelatin or oxidized cellulose which are applied, kept over the surface so that they may precipitate or they may induce the clotting. They are the other choices which are used, and they may be comparable to the 4 protocols of Sushruta, of Sandhana, Skandana, Pachana. That's about the prevention of the bleeding. Then Dahavakajwaravtam, Vradanam, Pittakopatah, Rakten cha Abhibhutanam, Karyam Nirvapanam Bhavet, Yathoktehi, Shitaladravyehi, Kshiraprishtehi Kritapladehi, Dishyat, Abalan, Sekan, Sushitam Avacharet. The Nirvapana is another of the protocol where there is a combination of lepa as well as sheka. Lepa, you apply something over the area and then wash it out. Now, washing, of course, there are many protocols mentioned by Sushruta like Kashaya or Avagaha. Now, all of them, they are the same issue. From the current point of view, they are the same of producing the wound irrigation. Wound irrigation is one of the methods by which you can ensure the better healing of the wound. And the wound irrigation could be by simply pouring that liquid over the area, as we do during the dressing. Kashaya is applied. Or at times it could be like the patient, that injured area is kept dipped in the kashayas, or at times you may use a douche to irrigate, like a balloon, and then with the balloon you may just wash it out. Or now you may have sophisticated instruments like the wound irrigators. Wound irrigators where there is a continuous suction and vacuum presented. So these are all the different materials by which you can reduce the slough formation, reduce the local infections, and washing effect is produced. So Nirvapana is such a method. Of course, it also involves 2 aspects. Like one, initially you have to have a lepa applied over the area, and then wash it out with the cold substances, so that it will have a perfect washing effect as well as a healing promoter. Vraneshu Kshinamamseshu Tamisravishu Apakishu Toda Kachinya Parusha Shula Vepasmatsuja वातग्रवर्गे अम्लगणे काकुल्यादिगणे तथा स्नैषिकेषु च बीजेषु पचेत् उत्कारिकां शुभं तेषां च स्वेदनं कार्यं स्थिराणां वेदनावतम्. Now this is again a unique concept of Susana where again application of Utkarika or a pour this heated substance over the wound. Now Utkarika like protocol is also mentioned in the Pachana Chikitsa where again you apply a Utkarika there in a condition where the inflammation is progressive but the wound has not formed. In a swelling in the Shotha Upakrama, Utkarika is mentioned as one of the Pachana protocols. Whereas if the wound has become chronic and there is not much of a discharge or the discharge is very little and doesn't get separated, there is no secondary infection conditions and there is not much of a granulation tissue and it's a hard, that's a fibrous wound, as such wound is fibrous and hence there will be cartinia and parusha as in case of chronic varicose ulcers. A warming up of the area, a gradual warming up of the area with some fermentations can be done to facilitate the blood flow, and Sushruta has suggested about a Utkarika, a puri-like substance prepared with the Bhatagana Dravya, Amlagana Dravya and Kakojanagana Dravya or any other Sneha Dravya added. With this you have to prepare a puri and then apply, keep it over the wound. Now that kind of a protocol is rarely done in a clinical practice, but folklore practices still continue to have that kind of a protocol. Then the next is Shodhana Kashaya and the wound irrigation done in case of the Nirvapana. They are almost similar from the current point of view, but Sushruta has suggested this as a separate protocol because the Nirvapana is done with an idea of removing the slough with the lepa as well as the washing. Whereas if the slough is loose and easily removable, you may not use the lepa and wash. Instead, you just directly wash. That is the Kashaya, Shodhana Kashaya. And the indications are Durgandhanam, Kledavatam, Pichilanam Sheshabha. Kashaya hi Shodhanam Karyam, Shodhanehi, Prag Udiritehi. You may use different dravyas for the Shodhana and depending upon dosha, where the wound is foul smelling and there is a lot of humidity and thick or slimy substances present over there. In the present day situation, you may use many substances for the wound irrigation. The options are many and the common options are drinking water, sterile water, normal saline, use all antimicrobial wound cleaners. There are many now alternate choices where antibiotic included there. Acetic acid, chlorhexidine or povidone or hydrogen peroxide, these are the substances which are commonly used for the wound cleaning. Or you may use any other wound cleaning substance, any other liquid can be used for the wound healing if at all it has these properties. It should be non-toxic and should not induce any immune response and it should reduce the number of pathogenic bacteria, but it should not induce bacterial resistance and it should not sensitize, non-sensitizing in the sense the bacteria should not become sensitive to or insensitive to the drug which you have administered, and it should be easily accessible, cost effective, and it should have a long life. These are the quality or maybe the options. If at all any other new substance, liquid, any kashayas can be used, but majority of the kashayas which we use may not have these the stability, and whenever you select a substance for the kashaya, you have to think of this the irritability, producing the irritation or the hypersensitivity in the patient. Then the next is Andashalyan, Anumukhan, Gambhiran, Mamsasamshiran, Shodhana Dravyayuktabhi, Vartibhi Stane Sakramam, Puti Mamsa Pratichananan, Mahadoshamsha Shodhayat, Kalki Kritehi, Yathalabam, Varti Dravyahi Purodhi, Varti or wick bandage is another of the technique, particularly in those deep-seated wounds which have maybe some irritant substance inside, and you have to ensure that there is a continuous drainage. To keep the continuous drainage, a wick packet is used, and or Mamsa deep-seated wounds, and the wicks were used by Sushruta were medicated wicks prepared out of Shodhana Dravya, and with the kalka you prepare a wick and then use that. Now, of course, we have different sorts of the wicks like polymeric hydrogels or polymeric foams or polymeric hydrocolloids or polymeric alginates. Alginates are commonly used in surgical wounds where are thick burns, whereas hydrogels are often used in other ulcers like superficial ulcers or surface ulcers as such. And in the market, you have plenty of these options available as a keeping of the wick. A simple drainage, either a corrugated drainage or a vacuum drainage, also could be another of the option by which you can facilitate the drainage of the pus. So, wick vacuum now is prepared done mostly with the ready-made available wicks, unlike that of what Sushra had prepared with the Shodhana Dravyas, Kalka, and the Kalka is dried up to prepare a wick in Sushra's period, but now you have ready-made materials. Then Pitta Pradustan Gambhiran Dahapaka Prabhitan Karpasi Palamishena Jayet Shodhana Sarpisha. The Shodhana protocol could be by Kashaya or maybe the Varti or the Sarpi, Taila, etc. Similarly, similar materials also used for the Ropana purpose. Now, idea of a Shodhana and the Ropana being two different issues, again a unique concept of Ayurveda. From the contemporary science point of view, you do not have these kinds of the two approaches like a Shodhana where you clean the wounds and then the next is the healing, promotion of the healing. From the current point of view, the cleaning of the wound and promotion of the healing, they go side by side. And maybe the antibiotics which are given to prevent the infection may be something like the idea of Shodhana, something like, not exactly, something like the idea of Shodhana, where you would prevent the sepsis or reduce the sepsis. And then the healing promotion, virtually there is not much to be done in the contemporary science for the promotion of the healing. Whereas Sushruta's approach has a very more detailed protocol which is quite relevant, where the cleaning of the wound is considered as one level, and once the wound has become clean and the healing process has occurred, you have many options by which the healing can be promoted. So cleaning and healing being considered two different approaches is quite a valid concept. And for cleaning, you have the options like the Geet or Taila or Bhatti or Churna, Kalka, etc. Similar substances are used for the healing also, where the contents are different. Now, for the Shodhana Sarpi, the Ghrita, Shodhana Ghrita, the indications are where there is a Pitta Pradustan Gambhiran Dahapaka Prabheditan Karpasi Palamishena Jayat Shodhana Sarpisha, acute infective ulcers with the deep-seated locations and where there is more pus formation. Karpasapala Mishrita Ghrita is used for the Shodhana. Or Taila is preferred in Utsana Mamsan, Asnigdhan, Alpasravan, Pranansra, Sashapasnehiktena, Dhimans, Tailena Shodhayeta. Now, in case of hypertrophied ulcer conditions, Utsana Mamsa conditions, one of the options which we have discussed is the Shodhanas, like either woman or the Virajana and the Snehapana done in the beginning. Whereas the local treatment, it could be, one is the Shodhana Taila, where you have more of Vata Lakshanas, Asnigdha or Rukshadra wound, which is dry wound, and the discharges are lesser, but there is a hypertrophy. In that condition, Taila with the Sarshapa Sneha, Tikshna Sneha is used for the local application. तैलेन अशुद्ध्यमानानां शोधनीयां रसक्रियां व्रणानां स्थिरमांसानां कुर्यात् द्रव्यैः उदीरितैः कषाये विधिवत्येषां कृते च अधिश्रयेत् पुनः सुराश्रजां सकासीसां दद्यात् चापि मनश्शिलां हरितालं च मतिमान् सदस्ताम् अपचारयेत् मातुलुङ्गरसोपेतां चक्षौद्राम् अतिमर्दितां व्रणेषु दत्त्वा तां तिष्ठेत् त्रिंशत् दिवसान् परम्. Rasakriya is something like the avaleh, a thick paste which is prepared by heating the substances. Of course, there are many theses written on these topics like Taila, Rasakriya, etc. The indications for that Rasakriya is when the Taila has failed to produce the Shodhana. Otherwise, the indications are similar that of the Shodhana Taila, where you have a granulation tissue which doesn't have much of a discharge, which is tending to become harder, which is tending to become fibrous like. In that condition, the thyla is indicated. Similar indication, but where the thyla has failed to produce the results, and the surface tends to become harder. In such conditions, rasakriya is done. Rasakriya, a paste of the substance, is applied over the area. Many times, the rasakriya also is understood as simply dara haridra kvata, which is boiled till it becomes paste-like. But Sushruta has suggested is you use substances like the surashtra, the crystals, or kasisa. Surashtra is these crystals of the potassium phosphate. Kasisa, the kasisa bhasma or manashila, haritala, these are used. Many of those substances which are otherwise used in the Rasashastra, they are mentioned in Sushruta. Now, of course, it's a different issue. If you look at the evolution of the pharmacology of Ayurveda, in Charaka, the very few rasaushadis, very few minerals were used, mineral drugs were used, and very few minerals were used for internal administration. Compared to that, Sushruta had more of the minerals and very few minerals used for internal administration, and majority of these mineral substances were used for the local application. The protocols of Shodhana and Marana, which are mentioned in the later books of Rasashastra, they are not mentioned in the Samhitas. So, the technology of Shodhana and Marana and using these minerals for internal administration becoming popular was a later contribution in the evolution of pharmacology of Ayurveda. It's a different issue, but very interesting issue. If you compare the number of minerals used in Charaka and Sushruta, there is a gradual evolution, and later on when you go into the Rasashastra, the number of minerals used are too many, and definite protocols of the Shodhana and Marana by which you may make these minerals homogenized, which can be consumed by the living being, are modified. So that's a suggestion of the evolution of the technology of Ayurveda. Anyway, that's the other way. But in case of Davrana, it is for the local application, external application, which is prepared with the Matlingarasa or Chaudra, etc. Then Mezojistan, Agambhiran, Durgandan, Churnashodhani, Upachare, Bishop Pradnah, Shraknehi, Shodhanavartijehi, Mezojista Varada, where there is a lot of slough. Mezojista Varada would have a lot of slough, dry slough rather, and which has a foul smell, but not very deep. In such conditions, you may have to use a churna, avachurna, dusting is there. That too, again, Shodhana churna. The Shodhana churna, the materials used for the Shodhana churna and Shodhana varti are same. The only difference is when the lesion is relatively superficial, ulcer is superficial, where you cannot keep that wick-like substance, you prepare a churna. Whereas when you have an opening and you can keep it inside, then you prepare a varti. That's a solidified material. Materials, the contents are the same. That's used for the superficial, foul-smelling wound with a lot of slum. Shuddharakshana-yuktanam kashayam ropadam hitam tatra karyam methodistaihi dravyaihi vaidyena janata. Shodhana is after the Shodhana, where you will have the Shuddha Vrana Lakshana. Shuddha Vrana Lakshana we have already referred to in the beginning. Once that process of the healing has started and the slough formation and the infective complications are reduced, you have those protocols by which the Ropana or the healing is done. For the healing, one of the options is Kashaya. Now, Kashaya is for Shodhana. Kashaya also is used in the protocols like Vimlapana or Nivapana as such. So, it's a similar material which is used, but the target is different, purpose is different, and the contents are different. So that's for the Ropana as such. Then Avedananam Shuddhanam Gambhiranam Tadevaja Hitaha Ropana Vartyanga Kritaha Ropana Varteha Ropana Varti, that's the same wicks which are similar to that of the Shodhana Varti, but the contents are different. They are used for Gambhira Vrana, deep wound Vrana, deep seated wounds which do not heal, which have started healing, Shuddhanam, where the healing process has started but they are deep seated. You need to fill up the gap, and that gap is filled up with the Varti, wick-like substance, and when the intensity of the pain is lesser. Then apeta putimamsanam mansasthanam arohatam kalkas samrohana karyam tilajo madhusayutah समाधुर्यात् तथा औष्ण्यात् च स्नेहात् च अनिलनाशनः कषायभावात् माधुर्यात् तिक्तत्वात् अपि पित्तहृत् औष्ण्यात् कषायभावात् च तिक्तत्वात् च कफेहितः शोधयेत् रोपयेत्यापि युक्तः शोधनरोपणैः निम्बपत्रमधुभ्यां तु युक्तः संशोधनः स्मृतः पूर्वाभ्यां सर्पिषा चापि युक्तश्चापि उपरोहणः तिलवद् यवकल्कं तु केचिदाहुमनीषिणः शमेद् अविदग्धं च विदग्धम् अपि पाचयेत् पक्वं भिन्नति भिन्नं च शोधयेत् रोपयेत् तथा. Now for the ropana, kalka is another of the issue where the slough is removed, apeta putimamsanam, it has slough is gone and it is a relatively deep-seated wound and the healing process has not kick-started, arohata, where the healing process is not going on smoothly. In that condition, a samrohana kalka is indicated. A kalka, a paste is applied. And Sushruta considered tila with the madhu, the sesame or jinjili with the madhu, the paste as one of the broad spectrum options. It can reduce the water because of its a madhura rasa and ushna guna and sneha containing oily substances. Because of its kashaya rasa and madhura rasa, it can be used as a pittahara, and because of the ushna guna and kashaya bhava, kashaya rasa and tikta rasas, it can be used for kapha, it can be used for shodhana as well as ropana. That's one of the best of the option which is suggested by Sushra, a broad spectrum lepa. The other lepas are nimbapatra madhubhyam yuktaha. With the nimbapatra and madhu, it can be used as a shodhana lepa, or along with these the tila, nimbapatra and madhu and the sarpi, ghrita, it can be used as a uparopana. It can be facilitating the healing much better than otherwise. Another option is instead of using tila, yava also could be used for the same, that's the other option. Then pitta rakta vishagantun gambhirana pjavrana ropaya dropaniyena kshira siddhena sarpisha. A ropana khrita is prepared with the kshiras and the ropana dravyas. Kashaya tikta rasa, madhura rasa dravyas are used for the ropana and they are used for pitta rakta vishagantun. The patients who are the lesions which are produced due to either visha, poisonous contents, or where there is a pitta rakta dushti, that's initially very infective conditions and very deep-seated conditions after the infection. After the infective process is controlled, then ropaniya khrita is used. Then kapha vatabhibhutanam prananam matiman bhishak karye ropanam tailam bheshitehi tatha udite tadyatho uditehi. The lesions which have been produced with the kapha and vata lesions, but once it has reached the Shuddha Vrana Lakshana, in the Shuddha Vrana Lakshana you will not have the dosha lakshanas, but previous history of that kapha vata would be the indication for the taila. Ropana taila has to be used as such. So in such conditions, ropana taila is indicated. Then samanam stiramamsanam toksanam ropanam vishaka churnam vidadhyatmadiman praksthanukta vidhiryatha. The ropana churna is indicated in the wounds which are having a uniform surface, flat surface, and the granulation tissue is progressing well and very superficial wounds. The dusting is done with the ropana churnas. The indications are very specific. Shodhano ropanaschiva vidhiri yoyam prakirtitah sarva prananam samanyana ukto dosha visheshadaha. Ropana and shodhana, they are specific indications in all kinds of the wound, and where you may not consider the doshas as the important issue, the primary issue. Dosha avisheshadaha. Dosha is not the primary issue. There the stage of the wound, like whether it has having the Shuddha Vrana or Dushya Vrana Lakshanas, is the wound. Yesha agama siddhatvad tathaiva phaladashnad mantravat samprayuktavyo namimam sektatanchana स्वबुद्ध्याचापि भजेत कषायादिषु सप्तसु भेषजानि यथा योगं यानि युक्तानि पुरा मया. Now these principles, they are the principles of the wound healing and the wound cleaning. They are the eternal truths and they cannot be just suspected, or there is no question of modifying this. This is what Sushruta says. Agama Siddhatvat, because it's tried by many generations and it's proved, and Pratyaksha Paradarshanath, because you have seen the results on your own. Mantravat Sampraktam, do not modify, follow it as such. At the same time, based upon your experience, you may have many options in selection of the substances used for this, but the protocols are the same. That's the important issue. You are supposed to follow the protocols as such, but the substances which are used to prepare the drugs like kashaya, churna, etc., they may be modified based upon your experience and your skill. So now, Sushruta is a very broad-minded scientist, where most of the times he would give the freedom to modify the technology or modify the approaches of the treatment based upon the clinician's experience and skill. But in a few contexts, Sushruta has used the other way, that there is no question of modification. There are two contexts which are used in the whole Samhita, where that possible modification based upon your capacity is inhibited. One is at this level, and the other is in case of the guna, dravya gunas. Namastadi Virajayata, where the based upon the experience of your whatever you see after giving the dravya, you have to experience it, and there is no question of any text which would, or any other statements which would modify the action. So these are the only two contexts where Sushruta would be rigid and then advise you to follow that traditional or whatever is written in the textbooks. Otherwise, Sushruta's unique identity is to give freedom. Anyway, that's another issue. Now, the substances which can be used for the wound healing in different areas, different levels, like kashaya or taila, ghruta, etc., are adyadve panchamulyo, tu gano yashta anilakaha, panchamula, that's laghu panchamula and bhrat panchamula, totally dashamula. They are preferred in case of vata drushti, sa vata drushti datavyaha, kashaya, this sapta. So in any of that, kashaya, kalka, taila, these dashamula dravyas could be used. Negrodadi ganaha yastu kakulyadishya smrataha, tau pita drushti datavyaha, kashaya, this sapta. So negrodadi gana or kakulyadi gana dravyas, they are used in pitta drushti lakshanas or pitta drushti conditions, either again formation of or preparation of any of these, taila, ghruta, kalka, etc. Similarly, arakodadistu gano yashcha usna parikirta tau deyo kapadrushte, samsiste sanyukta ganaha. In arakodadi gana is or any other usna dravya is considered as an option for the kapadrushti lakshanas, and wherever there is a dosha combination, you may have the combination of these assets. That's about the Shodhana and the Ropana. The next part is about Dhupan. I think we will continue in the next session and conclude this chapter. If there are any questions, I try to answer the questions, and